Welcome to For the Health of It, an intimate look at public health in Cowley County, Kansas. Join us as we discuss topics that are impacting public health in our community and learn about what we do at your local health department. Hello again, everybody, and welcome to another edition of For the Health of It, our little podcast here at the Health Department in Cowley County. With me today, as always, is the wonderful Allie Payne. Allie, how are you today?
I am doing well, thank you.
Good. You know, it's been a little while since we've done one of these trail mix episodes, and today I think it's a good time as we're getting into those real dog days of summer, and we're going to be talking about some things that folks need to be aware of and get moving on. I think today what we're going to do is we're going to talk a little bit about the flu shots, and we're going to talk a little bit about making sure we have kids get in for their back to school immunizations, because it's that time, right? Yes. And then I think we'll tie it all up by chatting a little bit about what's been going on in Washington with the administration, the big beautiful bill, what effects that has had on the state health department that we can see, and how that trickles down to affect all of us in local health departments, specifically how it's been affecting us here in Cowley County. So I think that's kind of the format or the roadmap for today. And let's start by talking about the thing that moms and pops should be doing right now if they haven't already.
You definitely need to be getting your kiddos in to make sure that they are up to date on all the immunizations they will need for school.
Yeah, I want to spend just a minute or two talking about the immunizations, because I know, that's just kind of a squirrely topic. Here's the deal. The new administration, Mr. Kennedy, has some really interesting ideas. Some of them I absolutely concur with. Others I'm a little bit skeptical on. I don't believe that everything that has happened in the last 50 years in the realm of therapeutics and pharmacology, especially as far as vaccinations goes and preventative medicine, has been bad. And the reason I say that is because the fact that we can stand on decades worth of results, and we can see the fact that, we had things like measles pretty much wiped out, and a lot of other things that we never have, and now they're back. And why are they back? Well, they're back because people have been empowered to say, oh no, I don't believe that this stuff works, or I don't believe I want it for my child. And then of course we see the results of that when now we have measles scares, or like we have one mom says, oh no, I don't want my children to have any vaccines, and the boy goes out and steps on a rusty nail, and then they have to take him to the ER, and the ER says, well, you're going to have him have a tetanus shot, Oh no, where do I go to get that? Well, you got to take him to the health department, and all of a sudden you're back in, you're looking us in the eye and say, hey, I need my son to have a tetanus shot. And we say, but I thought you didn't want vaccinations, right?
Right.
Come on. I see you smiling. You can talk.
Because some of this has happened with the measles and things before too. We've had inquiries about, measles in the area. Maybe my kiddo
should
needs
have it,
this,
or
but only measles. We don't want the other stuff right now.
Really, no mumps and rubella. Oh heck, we don't have to worry about them at all, right?
Right, no. Or anything else.
Yeah, no. The point being is these required immunizations are designed to protect the entirety of the population, and you do that one person at a time. That's how you become immune, right? And there is no place, I think, ever better designed than a schoolroom as far as a confined area to spread illness.
Oh, yeah.
That's why we talk about it more and more during the winter months and everything else, because a lot of things happen. We congregate in enclosed spaces. We're close together because we're inside, not outside anymore. And the littles are always the first ones to get it. There are little petri dishes that just little germy slime balls. I love them.
Right.
But anyway, that's the thing. So set that aside. We really want to have the right conversation with people. I am not going to sit there and say and ridicule anybody for having questions and having concerns. What I want, or what I'm begging people to do, is to ask those questions. We won't laugh. We won't roll our eyes. We will show you information, data, tell you everything that we have, because we want you to make the right informed decision for your kids. And we hope that you will continue to keep them immunized, because the laws haven't changed. That's the crazy part about it. Oh, I don't want to take this. Okay, fine. You have the opportunity to opt out. But if all of a sudden it happens during the school year, guess what, Mom and Dad? You better be ready to stay home and homeschool your kid for, 6 to 8 weeks, whatever it's going to take, because your child won't be allowed to go back to school.
Right, and we're not just talking about if your kiddo is the one who becomes ill. It's if anybody becomes ill.
Yeah, it's that impactful. So learn about that, know about it in advance. We don't want you to be caught unaware, and we certainly don't want to have to be the place that tells you, no, you can't come in and get a shot because we're out. Do it now while we have the vaccines in stock. Do it now while it's slow. I mean, you could call today, get in, get your stuff done, and get out, and save yourself the hassle of having to wait till the last minute. Right?
Yes, absolutely. And while we're talking about this, I actually want to say something that we've been doing a little bit differently in the last few months that I think has been very beneficial for anybody who's come to the health department, particularly those who don't have health insurance for their kiddos. Historically, we were charging a $20.25 fee per vaccine. We've adjusted some things, and so now if you are in that cohort and you come in and you get one dose of whatever, that's what you would be expecting to pay. But if you get 2 or more doses of anything, then it's just a flat fee of $25. And so I think that makes it more affordable, certainly for families. But we've also, since we've started doing that, we've had some of those families for their kiddos pick up some of the other things that are not required for school. So
yeah, that's great. And I'm glad you brought that up, because the pressure's on for folks who don't have insurance.
Certainly.
And the kids should not be made to suffer.
No way.
And that's why the program does exist. It's called Vaccine for Children, VFC. And that program is still being funded. And that program we are still very active in. And when you sit there and say, well, what does that mean? It means that these immunizations and the shots that cost sometimes several $100s, you don't pay for that. It's covered 100%. And all you have to do is pay for that administration fee. That's the fee that helps us keep our lights on and keep our nurses employed and all of that. And I will not lie, we do depend upon these things. We are a business too, and we want to make sure that we do it. We have gracious support from a lot of places, but we have to be run like a business, and so yeah, come use us. I mean, that's why we're here. If you ignore it and you don't go, guess what happens? These opportunities disappear over time, and then you don't want that. You don't want to have a community that doesn't have a good, vibrant health department or a place for you to get this kind of help, right?
Correct.
All right. Anything else about the VFC or like I say, it's the time. Get ready. If you don't know if your kids are needing shots, give us a call. We can look those records up. We can help make that determination, get you guys scheduled, get you in at a convenient time. Our hours every day are from 8 in the morning till 4:30 in the afternoon. You can come even during the lunch break, because we used to close from like noon to 1. We don't do that anymore. We stay open the entire time to help you be able to navigate it on your schedule. We want to get you guys ready to go and keep everybody in the community healthy. That's it for the, I guess, back to school portion of it, right?
Yeah, absolutely.
Okay, cool. What do you want to talk about next? Do we want to roll into the flu, or do we want to roll into Washington?
I mean, you have segues to both. We just talked about VFC, but we've also been talking vaccines, so maybe we should stay that way.
Let's stay on the vaccine side, okay? Flu doses, flu shots. A lot of debate back and forth with people. Oh, I don't ever get that. Oh, I get it. It makes me sick. And then there are those that are kind of like me. And hey, it's not because I'm actually the public health officer and the administrator here. I have not missed in 20 years a flu shot. And I cannot recall the last time in that 20-year time period where I have been down sick for a long time period, or out where I couldn't work, where I had influenza. Is that just anecdotal? Maybe. Am I just lucky or healthier than others? Maybe. But I also work in a field where I'm around folks that are sniffling and sneezing, and they get sick all the time, and we do promote it. So I am an ardent supporter of influenza vaccine and getting it on an annual basis. We operate like a business. I mentioned that a little bit earlier, and we have to be able to order those vaccines in, and they are expensive and they cost money, and we have to pay for them up front, and then we get reimbursed when we sell them later in the year. any business that comes under pressure, they try to manage their inventory so they have just enough, so they're not going to be stuck with things at the end, because there's really no clearance rack for vaccines.
Correct.
You know, you can't walk into a health department and say, hey, what do you got on sale today? Because those things have a lifetime, an expectancy date, and an expiration date. And we have to basically make sure that we have those and we get them administrated. If not, we lose money. And we don't like to lose money because it's taxpayer dollars or it's other dollars that otherwise should be being invested in the health of the community. And so this year, because of the external pressures, and by that I mean the fact that people are sitting there saying, no, I don't think I want to do this, we're actually going to be ordering a little bit less vaccine than we've had in the past, where we always in the past had the mindset of, oh, we want to make sure we have it so that nobody would be denied. Now we're like, well, we're not going to eat it. We're not going to, be throwing $10,000, $20,000 worth of vaccine out the door at the end of the season. It's just not something that's affordable that we can do. So all of a sudden, that creates in a business model a little bit of a scarcity. And we have a lot of people. How many folks, Allie, do we help every year? It's probably what, 1,500 to 1,800
Oh, sure.
that are people in the community. We see them every year.
Right.
Right.
And we see all populations,
Yeah.
the babies at 6 months all the way through those who are in their later years.
Yeah, we have to. I see how you're smiling at me because those later years. No, we do. We have. Who was our oldest client last year? They were almost 100, weren't they?
Right, 102.
102. Yeah. So I got a little ways to go to that, but anyway, the point being is that this year we're going to be sending out really soon to those folks that have utilized us for their flu shots in the past, a little postcard letting them know, hey, we've got it. We're really proud that you've been with us. We want to be there for you, but we want you to call in early and reserve that shot. We're not saying you have to get it today, but we want to make sure that you are not going to be left out. And it's going to be very simple. We just want to make sure that if you are going to be visiting us for a flu shot, that we're going to have enough to make sure that we can cover our needs and make sure everybody that needs it gets that. But our goal at the end of the season is to not have any wasted. And so there is a little bit of a scarcity. So when we're going to be talking about that, we really do want to make you aware that that's what's going to happen. Now, let's talk a little bit about the types of vaccine that we're going to be having in. I think this year there are going to be 4 different types that we bring in. You want to talk about them a little bit and let folks know what they are?
Sure. Do you have any kind of preference where we begin?
Let's start with that very basic flu shot. What is it? Fluzone?
Yes.
The Fluzone. Now, we do use a specific manufacturer, a specific company for 3 of the 4 shots. We have utilized them. Their vaccine has historically been very good, very strong, matched very well. Always a superior product, and it comes from Sanofi. They're a Swiss manufacturer, I believe. And anyway, we've got our order in. We should be starting to see those doses arrive later this month.
August.
Well, yeah, August, because by the time this is out, this is the last day or so of July. We're gonna be in August when this hits the airways. So it will be coming very, very soon. So they have 3 products.
Yes, and we bring in all 3. So that first one that he was talking about, that is the Fluzone, and that one is approved for anybody who is 6 months and older. An important note for all of these vaccines that we're going to be talking about, and any vaccine that would be to provide protection against the flu during this upcoming season, is going to be what they call a trivalent, just meaning that it's going to provide protection against 3 different strains of the flu.
It used to cover 4. They were quads. They were
Yes.
quadrivalents. But I think there was one strain that was the Oriental.
Yeah, it
flu.
was the.
I don't know.
It was one of the bees.
Yeah, one of the Oriental bee strains that has been gone for I forget how many years now.
Right.
And so that was removed from the mix. And what we see every year is H1N1.
Yes.
That's one that's always in there. And then is that an A strain?
Yes.
Yeah. And then we've got.
We'll have H3N2. That's been in several years. It's another A. And then we have the 1B strain from that Victoria lineage.
Right. There is nothing in this about bird flu.
No, there isn't.
Nothing like that. So when you hear people talking about that, or the avian flu or whatever, that is not covered in this vaccine whatsoever.
Correct.
The first one is the flu zone. It's a very good shot. It's 6 months to, I mean, you can have that
You can have it forever.
right? Through your entire lifetime. And then the next one is a little different.
Correct. So the next one would be the flu block, and that one is quite a bit different. It's actually approved for anybody who's 18 and older, and it's recommended for anybody who is 50 and older. Again, still a trivalent. But what's specific about that vaccine is that the antigen that they have in the vaccine, so essentially what they have, the makeup of that vaccine, it's just a little bit stronger. It's to help people who maybe have a chronic health condition that might make them immunocompromised or more susceptible to becoming ill, which makes sense for anybody who would be certainly in that 50 and older age cohort.
There's something else about that specific one.
Yes, that one is different from the 3 Sanofi products because it is completely egg-free. They do not use eggs at any point during the production of that vaccine.
So for folks that may have some kind of an egg allergy, that was the real reason we originally brought that on, and we've had this online I think for like 6 years now. The very
At
first,
least it's been here the whole time I have.
yeah. So I think it was. Yeah, I remember the first time we brought it in because it was new, and I was like, I don't know. It was expensive, but I rolled up my sleeve and took it.
Right.
And I won't take anything else. And I'm 66 years old now, so.
Yeah, it provides really great protection for anybody, again, who might just have a few health conditions that they need to be monitoring.
It is, like you say, it is magnitudes of order stronger. I think it was like 3 times stronger than what the original was.
Right, definitely enhanced.
And then, of course, there is another one that we get that I think has probably been by far and away the most popular that we've got, especially with our elder cohort, and that is
Those who are 65 and older, and this is what we just call the high-dose vaccine. That's what the manufacturer calls it too. High dose, and we typically get the phone calls and the requests for the one that the old people get.
Yeah.
So we always make sure to bring plenty of that in. Again, it's a trivalent, but this one is special because it provides 4 times that protection against those flu strains. So again, very important for those who are aging. This vaccine is egg-based.
Right, and yet it has been very well tolerated. People seem to that get it have very good protection. This is one that we give to a lot of folks that are perhaps living in retirement centers or homes or just are elderly, because it does provide that good of a protection.
Right. And each of these vaccines that we've talked about so far for flu, they do of course contain parts of the flu viruses that we talked about, but none of them are not live viruses. I think that's very important. We get questions about
attenuated? Isn't that what it's called?
Inactivated, yes.
Yeah. So that's that, and then we've got a new one in the mix this year.
Yes, and personally, I'm pretty excited for this one. I really like the science that's behind this one. So
okay, now, we're not going to bash the science, so you're setting yourself up. But tell us about it. Explain to me what it is. Tell it to me like I'm 5 years old.
Okay, so we've talked a lot about egg-based vaccines, and we'll just start by saying this one isn't. So this one is called Flucelvax. And the manufacturer is completely different. It is CSL Seqirus. That vaccine, it is recommended for anybody who is 6 months and older. It's still that trivalent, but we know that it is egg-free entirely. So what makes this vaccine different from the 3 that we've talked about is that it's very different in how it's manufactured. Rather than being a recombinant like the flu block or being grown in eggs, it is grown in mammalian cells. So with that, you think about who we are. We're mammals. And so that's kind of the idea, is that its production would be more similar to kind of what we as humans might prefer or might need for our genetic makeup. Basically, what that means is that when the vaccine is in early production, it's going to be completely the same at the end of its production. We
get kind of nerdy and kind of geeky on this, and even we're not scientists, but we also understand that there is kind of like a drift between what happens when a vaccine is formulated and then when it's replicated.
And it has to most of the time.
They drift. So what does that mean? Well, it's like trying to put your right hand into a left-handed glove.
Sure.
Okay?
Close, but not quite the right fit.
Exactly. Your thumbs are, and it doesn't fit in right. What we hope to have, and this is why I always liked the one that I take, the
flu block.
Flu block. Yeah, the flu block so well is because it cut that down.
Yes.
It reduced that drift. So that basically when we were trying to, in the medical realm, identify, in the southern hemisphere, what was happening during their winter, and anticipating how that flu was going to migrate around the world, and it does so very rapidly. Anymore, we could see, okay, exactly this is the strain, and how do you combat that? You wanted to replicate that as closely as possible, and if you could get that exact replication, then your vaccine was way more effective, because your body would get it, it would build the antibodies, it would identify that once you were attacked by it, and bam, it just lined up perfectly, and you didn't have if you did have any kind of a deal, maybe you had the sniffles and a cough or something like that, but you did not go down with the flu. Now this changes that again, in the fact that this type of the Flucelvax does that same thing, and they say this is almost like an exact fit, like a second skin. So which is really kind of, so it's like putting your hand into a latex glove instead of a mitten or a leather glove. Trying to create an analogy that people can wrap their heads around.
Right. I appreciate that. This process, it has to occur when we're working with eggs. Each time that virus replicates, it has to adapt ever so slightly, right, those proteins. That's actually for our benefit too. This Flucelvax vaccine is just different because it's grown in cells from the start. So that antigenic drift that you were talking about is not going to be a factor the same way.
When we talk about mammalian cells, we're not talking about humans. We're not talking about some kind of stuff that's not allowed. It's not that. It's the new type of science that we see emerging across the area. We see and I do this myself, I kind of slam the pharmaceutical companies because I know they're trying to make a profit and everything else, and they'll put something out and all of a sudden you're bombarded with, their commercial every 30 minutes on the hour when you're watching TV or whatever, and about things that you can buy. But I also know that there is a great deal of science that goes in and research and study to make these better and better and better. The idea they already know is that we're never going to defeat influenza. We're never going to eradicate these things, but we can at least make these vaccines more effective. And that's important. The new technology, those things got, I think, hammered really bad because of the pandemic.
Right.
And I don't want people to sit there and say, oh, it's just terrible, all these things are bad. No, I still have my hurt feelings, and I'm still angry at certain manufacturers and such for claims they made or didn't make. But the other part about that is the ones that we bring in at the health department, we bring them in because they're trusted, they're known. This is not anything that's brand new, although this one will be for us, it's a new one. So for us to even bring it in, we did a lot of research, and we did a lot of looking too to say, hey, do we think we have folks in our community that may benefit by this? And we said, yeah, we do. So we're bringing in a little bit, not a bunch, but a little. This one's going to be a scarce item. So you'd have to really want to know about that, and you'd have to ask, and we'd have to make sure it's a really good match for the individual. It's not going to be just walk up and get it in the arm. Anything else about any of these?
I think that's okay, without getting too geeky.
Without getting too geeky.
Yeah.
Again, we're going to be pushing it. We're going to be advertising a bit more because we want to make sure that, again, two reasons. We want people to commit to it early. You don't have to take the shot early, but get it. We also want you to commit to your health department. We're here for you. We're here every day of the year. We work every day to help you stay well, all of that good stuff. Hey, but we need your commitment to help us too. And if you don't utilize us, then everything that we do, all of the good works that we do, they're kind of kind of wasted energy, and we don't want to see that happen. Anything else on flu?
Yes, I would like to go ahead and share the dates that we have for our
All
special
right.
drive-through opportunities. We always host 2 in October. This year we're expanding just a little bit. So we will be doing one at the health department behind our building at the Winfield office on 8th Street. If you ever had a COVID test done, it'll be done in the same fashion. You'll just stay in your car. That's going to be on September 29th from 2 to 4 p.m. October 8th, we will be at the Arc City Ag building. We'll be there from 10 to 5. October 15th, we will be at the Winfield Fairgrounds in Barn 4, also from 10 to 5. And November 10th, we will be back at the Winfield Health Department office behind our building on 8th Street from 2 to 4 p.m. So there are several opportunities where you can come and get your shot from us, and you don't even have to get out of the car.
We added the ones, I think last year we did the first when we did it here, because we had some folks that, they wanted to come get it, and they were busy on those other days, or they couldn't get away. And so we said, hey, why not? We learned a lot as far as being able to have you roll up and get these things done. And so if you can drive by, we can take care of that.
Yeah,
And
we'll
you don't
also
even have
be
to
at
get out there.
the Walnut Valley Festival
That's
this
right,
year too.
Walnut Valley.
So-
We're going to be out there. So if you're, and that's going to have a little bit more. We're going to have things like maybe flu shots, early ones there for people that might want to take advantage of that, because it's never too early when you're in a congregate setting like that. But we're also going to have some other like minor first aid things available there. It's geared more towards the people that camp out there. So we have a lot of folks that come into town and they visit, but we have a lot of locals that go out and camp.
Yeah.
Okay, and they're running around, and the kids are, they fall, or somebody slips and skins a knee or needs to take a look at, and so we're going to be there. We don't know exactly what that schedule is. It's during the time after Land Rush,
Right.
but before the festival itself starts. When the festival is going on, we're gone. We're not going to be there, because that's not that. We're there to help the people that are camping or out there prior to that's about a week, right? And so we'll be out there.
Right.
Well, I'd imagine we'll probably be out there for the 2-3 hour blocks, 2 to 3 times.
Yep.
Yeah. So
It'll be great.
So look for us, and we will be there. All right. So let's roll into the next one, which is going to be our talking about external impacts to public health that are beyond our control. And no matter where you are, and this is not political, this absolutely is not political, but we have to understand that there are things that influence public health that we don't control. Back when the pandemic began, I remember, and Allie, I don't think, because you may have just started, so it wasn't you, but I lamented to some folks that were, I was confiding in this, is that my biggest worry was the fact that public health was going to become the whipping boy of what was to come, because you mixed politics into public health, and that's a no-win situation for the people that do the jobs at the local level. I think I was kind of right on that. We had a lot of stuff coming. So now, we've had administration changes, and we've got new players in Washington. They've been there now doing their business for the last 6 months or so. A lot of good things, a lot of interesting things. The one thing you can always guarantee is something's going to happen every day. And my big concern is what's happening and how is it affecting the funding that's available for public health, because by its definition, you do get some funding from the federal government to take care of certain things. The Department of Health and Human Services is the big boy that takes care of the CDC. The CDC works with the states. The states work with our local offices, and there is funding that flows through those different channels that help us pay for programs that we have here in our county, that without those dollars, those programs would not exist. If you ever pick up one of our flyers and you take a look at it, think about what we have on there. There is Women and Infant Children, the WIC program. That's a big one in our county, and that is funded in large part by the federal government. And if they pull that, that is going to have a dramatic effect on the residents of the county. Those little kiddos that qualify for that, and the moms and the pregnant moms that qualify for those services, they're not services that they're on their entire life. These are timed services. I mean, they're there to help children from birth, actually before they're born up to they're 5 years old and getting ready to go to school. They're there to help moms while they're pregnant and while they're breastfeeding, or while they're lactating afterwards, to make sure that their health stays good. But then they subside, and those are not real big giveaways. They're nutrition based, and the whole idea is to make sure that they are eating correctly and they have a good feel. And what are we talking about? What are we hearing out of Washington right now? How we eat terribly, right? What have we talked about in public health for decades? That our nutrition is bad, that we don't eat right. We consume too much. We always get bashed because we're the naysayers out there. No, don't drink, don't smoke, don't eat fatty foods, don't. People get tired of hearing us saying that, so you have to try to work it around to where you can convince them. I tell you right now, there has never been a time in my career where those topics have been front and center in the news all the time.
Interesting.
And they are now.
Yeah.
And on the nutrition side, I can buy it. I'm not, like I say, a true fan of saying, that, that by saying the word vaccine, you're going to grow a third eye. These things are nuts. I mean, it's not the case. Again, we have the science. Now, we talk about science, and
Right.
It can be kind of scary, right? And one of the things that I get concerned about is the fact that people are going to shy away from it, or they're going to use it as an excuse not to do the right thing and to keep them healthy, to be able to prevent things. It's difficult to prove prevention. Would you agree?
Oh, yes, especially right away.
Yeah, because how do you prove that, I took a shot and, I didn't get sick? Well, the real easy way, but it's terrible, is if you're the only one that took the shot and the rest of the people in the family all got sick but you didn't.
Right.
Would you say then that shot was effective or that it worked? Probably. But how do you convince people to take that leap of faith? So we're asking folks to make sure they do that. But the true effect on all of this stuff, and I can't say that there probably wasn't a portion of this in the legislation, was that in trying to eliminate wasteful spending and some other things, there are some good programs that are probably going to be cut. Okay? I have no control of it. I can't change it. I can lament the fact. We can hopefully show that, hey, these things are done. There were other programs that probably should have been cut. I'm not going to go down that path either. But when it comes to the health of our population, I know for a fact that until every McDonald's closes, till all of the fast food chains close their doors, we're going to continue to be an overweight society because we don't eat right. And that's a big part of our problems, plain and simple. And then the fact that we are very easily swayed. People, I think, are easily swayed. I don't want it to come across as being some kind of a snob or a public health geek, but yeah, at the end of the day, I am. I believe in this stuff. I wouldn't have spent 20 years of my life doing it if I didn't believe it. And I know it impacts and it helps our community, be better, be healthier. And if we're healthy and we're having fun, our communities are better. So the trickle down funding that comes through, we've seen a decline. What did we say? We're about 30% less this year from our state partners than we have been in the past.
Yes.
So at the local level, when we see 30% less funding, well, what kind of effect does that have? Well, we take a look internally at what do we cut back? What do we roll back on? Sadly, we know for a fact too that it affects people.
Right.
Because we have staff that we bring on, and so if we see a reduction, we know that, hey, we are going to have to retool things, and we may have to contract staffing in that size and not offer as many things, and that's hard.
It is tough. We've been very intentional so far to make sure that these impacts aren't felt by people who come to receive service here, but
Yeah.
we just don't know what's coming.
But you don't know what's going to happen, and we don't know how long it will continue.
Right.
Okay, I'm hopeful that after the the new baseline is set, things will be good. And then if you know that it's going to be, and you can at least know what you're going to count on, then you can go back and kind of rebuild. It's just like everybody else. We have to live and work within our budgets. We also get local funding. We get money from our two communities, the big ones, Arc City and Winfield, and we get a contribution every year from the county, and that is statutorily required, but those things are what we use to make sure that we can function on a day-to-day basis, but they only comprise, between the two of them, about half of our budget. That other half comes from people actually coming in and using our services, because yes, we will charge insurance, we will bill, but we don't charge exorbitant amounts.
No.
It's those fees for the services and everything else that we have that basically really keep us moving forward and keep us going. So when it's times like this, my plea to the community is, please use the services that we have. Come see us, be involved with us. Come here for your, if you're going to travel and you need a travel vaccine, come here and get it. You need the flu shot, come get it from us. Anything along those lines. Excuse me. Now is the time for you to go ahead and do this.
Some other really cool things about just coming to the health department in general that I think are really special is we don't charge copays.
Right.
So that's one thing that you don't have to worry about on top of everything else. So you can come in and you can receive your services, and we'll take care of those things accordingly. Another thing too that we hear quite a bit, I would say, in the general public, is that people can't come here if they don't have state insurance, if they have a different insurance plan like Blue Cross and Blue Shield. That's a myth. You can come here if you're anybody and you need any service that we can provide. We see folks who are uninsured, and if that's the case, sometimes we can help you get health insurance. We see people who do have state insurance, and we see people who don't have state insurance but have a different plan. So you can come to the health department and we will provide the service that you need for your health.
Exactly. And, I don't have the money. Well, money should not be an obstacle to health care. I know that sounds kind of weird, but it's like we've had people that, in the past had to get immunizations for kids or for themselves and whatever. And so they said, I only have $25. I can pay you off, over the next couple of months. Great, fine. Not a problem.
Yeah, absolutely.
Come in, talk to us. We'll make it happen. When I first got here 10 years ago, my biggest concern was, how does the community view the health department? How do you see us? What are we to you? And during the time I've been here, it has been my focal point that I really wanted us to be, that trusted source in the community for you to be able to go to and get help. And I hope that's been accomplished. Don't let it stop. Your health department in Cowley County is one of the most vibrant ones in the state. We do things in Cowley County that you do not find in other communities of 30,000 people. Now, we provide services, and we stand toe-to-toe with all the big boys, with the Sedgwicks, the Johnsons, with the Shawnees, and the Douglas County. You talk about the big health departments, we provide as many services as they do. We just don't serve as many people, but the options that you have with us are that vast. And so get out, come see us. I'm asking that from the community. We've been here for you. We need you to be here for us, especially when times start to get a little tight.
Yeah. And you know what? This is our 79th year of being here for the community.
79.
Yeah.
Hallelujah. Makes me feel a little younger.
It's pretty special.
Well, anyway, that's kind of, where we're at, and we've spent a good deal of time, and Dan's over there showing me the it's time to wrap it up sign so that we can get this put on the air again. Anything that you want to add, anything that we may have missed? We've got other topics coming up here, not, in the near future we're going to be talking about.
I think we're good for today.
Yeah, okay. Dan, is there anything that you want to throw at me? No ballpoint pens, no coffee mugs?
He says, no way.
No way, man. He says, I'm not even going to speak up. It's your guys' show. So once more, hey, thank you very, very much for spending part of your day joining in and listening to us opine about public health and all things health related here in Cowley County. And as always, I hope everybody
stays well.
Thank you, everybody. See you soon. Thank you for joining us for this edition of For the Health of It, Cowley County. We hope you found it useful and that you'll tell your friends and give us a listen again during future episodes. As always, we end today's segment by replaying a recent Public Health Minute, which is a weekly radio message focused on keeping you healthy. So, until next time, stay well, everyone. It's August and back to school month has officially begun. With just a couple of weeks of summer left, time is running out to get your child's immunization and health assessments taken care of. The health department is here to help. Our public health nurses can administer all of the required vaccinations, as well as your child's yearly checkup. But now is the time to act. Give us a call today and set your appointment. Keeping your kids healthy and safe for the school year, just another way the health department works hard every day to help you stay well.